healthcare system. This is a problem that I have been fighting in Washington for the last few years. And because of knowing this and working with our local elected officials, my 3-bill rural healthcare agenda that we talked about as a 2020 priority will increase access to health care for the 60 million Americans who live in rural areas. Now, this legislation didn't happen by accident. It comes at the direct request of many of our local mayors and local leaders who are struggling to keep hospitals open and to keep communities healthy and have access to affordable health care. The increased access to health care isn't merely for convenience, and it shouldn't be seen as a luxury. This is something that will save lives. A crucial component of my rural health agenda was a set of provisions that lifted unnecessary regulatory barriers standing in the way of access to telemedicine. As always, it is the red tape that gets in the way. Provisions I supported as part of the CARES Act further expanded access to telemedicine by removing even more red tape and providing funding for reimbursement to frontline healthcare providers. My bipartisan rural health agenda jump-started and quickly expanded the use of telemedicine programs, and last month, Vanderbilt University Medical Center tallied over, get this, 200,000 individual telehealth visits since March. I look forward to continuing work on expanding access to health care for all Tennesseans in 2021.